So you've just had your ACL surgery. What is it that you need to do to recover as quick as possible? Today I'll be talking to a physiotherapist to find out just that. After an ACL reconstruction, rehab is obviously important. So what do the different phases of that rehabilitation look like?
So generally speaking, there's 4 phases. So you've got the immediate phase, which encompasses like the first 48 hours, week or 2 post-surgery. You then move into the early phase of rehab, which is usually the first 6 weeks. Then you progress on to like the functional phase, which is primarily strengthening. And then it finishes with what we would call the sport-specific phase, but that might just be the phase where you return to your normal activities, normal exercises, normal daily living.
Going upstairs
Normally.
for a bus.
Yeah, the looking after children, the normal bits.
Oh, difficult stuff then.
Yeah, the real work.
So let's dive into that immediate post-op phase. What is the main focus?
Main focus is controlling the swelling, reducing pain, and starting to regain normal range of movement and weight bearing through the leg. So it's just to get the ball rolling on the start of the recovery so that you're not becoming overprotective.
What would be the issues if someone was overprotective at that point?
The knee's going to stiffen up.
Okay.
Initially post-op, you're going to lose strength. It doesn't matter how strong you are before, you're not going to be as active initially, so you're going to lose strength. We want to try and reduce the amount of strength and range of movement you lose. If you are overprotective, it's going to stiffen up, you're going to lose more strength, and it slows down what's already a long recovery. There's a lot of fear associated with ACL injuries, ACL surgery. We need to start to restore someone's confidence in the knee, and that starts from day one. Okay, you're not going to be running day one, but we need to get you walking normally, getting that knee moving.
So you spoke about the second phase. What is that early phase of rehab? What does that look like?
So that's where things start to progress on a little bit. So we have sort of set targets that we're hoping to achieve by the end of 6 weeks.
Okay.
So by the end of 6 weeks, you should have full extension. So that's the ability to fully straighten the knee.
Right.
We want a good range of movement in regards to the knee bend. Every surgeon has a slightly different degree that they're aiming for, but we want good range of movement. Won't be full, but we want good knee bend. You should be walking normally during that normal phase, so you should be off the crutches. Dependent on your protocol, you should be walking normally. And there's some very light strengthening that we start to do. I mean, it's not really strengthening, it's more just getting those muscles working.
So as we move into that functional rehab phase that you said, how does the intensity of what the patient is doing, how does that start to change?
So it picks up a little bit. That's the phase where you start to move on to more traditional strengthening exercises. You'll have done a little bit of that in the early phase, but you start getting people squatting, lunging, leg press. There's a progression from double leg exercises into single leg exercises during that phase. It's also the phase where you might start a little bit of impact. So you could feasibly doing some light straight line jogging during that functional phase. But really it's primarily building up the strength around the knee so that it's good to go when we start doing that impact and sport-specific rehab.
So finally, we're in that phase of we're returning back to sports, or if you're Joe Public, those normal activities. This must be like surely a momentous phase, right? Everyone's getting excited. Some people might even be stronger, I'm assuming, than what they potentially could have been to start with.
Yeah, a lot of people are. If they've stuck to the rehab over the sort of first few phases, generally speaking, they're in a better position than before they did the injury. But yeah, it is a big phase. It's about the fine tuning. So that's when we we'll have done some screening throughout, but we're really looking at, right, is this individual ready to play the sport that they want to play, or are they ready to sort of go, right, you are good to go with your normal activities? So yeah, there's a lot of assessment on how the knee's functioning. It's not just about, is it strong? Does it move well? Are you able to do the things that you want to do safely to, again, minimise that risk of re-injury in it? So it is a big phase.
Is this now like a lifelong thing that they're going to have to do? Or they've finished their, let's say, 9 to 12 months, they've done everything as they're meant to do, cool, we can just stop all the rehab now and just continue life as normal? Or should they be continuing these things?
In a lot of ways, they should be continuing it.
Okay.
So, yes, we don't expect you to be doing a rehab program every day of the week for the rest of your life. That's unrealistic. But if you play sport, you shouldn't just be playing your sport. You should be doing the work so that you can play that sport to the best of your ability safely. If you want to remain fit, active and healthy, we should all be exercising. So a lot of the fundamentals you take from the ACL recovery, they're just good in general. It's good to exercise, it's good to be strong, it's good to have good stability.
Absolutely.
So it's not just right, you're 12 months post-op, off you go now, do whatever you want. In an ideal world, things that you've taken from the recovery process, you should implement forever.
So all transferable skills.
Definitely.
Thank you for watching. So to get more information on everything that is ACL, click here.